So we had a patient coming to our practice. His complaint was when he's taking air through his mouth, he had a lot of sensitivity, and sometimes when he's biting, the pain really aggravated. So now let's look at what are the possible causes that can cause this, what could happen, and how do we go about finding out the best method to treat this. So hello all, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Amalapuram since year 2001. If you have not subscribed to our channel Pearls Dentistry, please do subscribe. We've got a whole bunch of videos coming out on dental education and awareness. So this presented a peculiar problem. So when we had a look into the patient's mouth, his mouth was otherwise clean. There was no decayed teeth present. So usually this pain, the sharp pain, can be caused when there is a decayed tooth. But the patient, there was no decay in his mouth. So now, but what other findings which we saw is the tooth were showing a lot of signs of wear. There's a lot of wear and tear on the tooth, and we can see those minute crack lines on all of the teeth. So having a closer look at the teeth, we found that one particular tooth had this crack line. So how do we see this crack line? One, because it's very difficult to see the crack line. Of course, we can use like a fluorescent light, show it through the tooth, and when you use the fluorescent light to show it through the tooth, the crack line is usually be visible. Of course, we can take a CBCT scan also. If the crack line is bigger, that crack line can get visualized nicely in the CBCT scan. So what can be the causes? One, I told you, because when there is a lot of wear and tear to the tooth, usually the patient's teeth are worn away, and there are a lot of deep pits and fissures onto the tooth. So these become some weak spots present on the tooth. And when patient is having something, when he's having his food, there can be something in his food that can act on the weak spot and crack the tooth. It can be like a small stone in the food, or it can be like a small pulses which has got these triangular shape. We can actually wedge itself in the crack, and when the patient bites, it can actually open up the tooth, split the tooth open. So if the crack is minor, so usually the tooth doesn't split open completely, and then it starts giving these kind of symptoms which are not very specific, because it's difficult to localize it completely, because it can mimic as if it's coming from somewhere else. It can mimic a sinusitis infection. It can mimic generally a worn out tooth problem. So when you take a CBCT scan, we can actually find out where the crack is, and then accordingly do a treatment based on how much the crack has progressed. Of course, we will discuss what are the steps by which we can treat this in our subsequent video. Stay tuned to it. Dr. Arun from Pearls Dentistry. Bye bye and thank you.